For the new show, I'm bringing you entertainment, guests, and advice on health and beauty. We all need inspiration now. We will look at how to live your life and love your life. To someone very interesting, and I'm sure you'll want to know lots about what he has to say today. Our guest is Bhav Padhiar. Welcome, Bhav Padhiar.
Hi, Halima. Thank you. Thank you for having me.
Coming. Thank you so much. How are you?
Very well. Very well.
Yeah. You've been waiting here a while. Sorry about that.
That's okay.
So tell us who you are and what your expertise is on.
Okay, so my name is Bhav Padhiar, Bhav short for Babish, and I'm a clinical pharmacist. Been a pharmacist now for over 25 years.
Okay, wow, you don't look that old, but okay.
And I've been working in hospitals since 2001.
Doing?
So surgical work, in terms I work with the surgeons. I was working on the wards, doing consultant ward rounds. One of the hospitals I worked at was a specialist burns and plastic reconstruction hospital. So for people who've been in burns, like all over body burns, they've had, serious injuries where parts of the body would have had to be reconstructed, rebuilt.
So what was your role in this? Sorry.
So as a pharmacist, what I was doing was making sure their medication, their sort of medical history, there was nothing that was going to impact or throw up any surprises on the operating table for their surgeons. And then we're looking at the treatment post-surgery and making sure that the patients would have the best treatment outcomes.
Okay. And then what led you to start your own clinics and start your own treatments? And we'll touch on treatments in a minute.
So obviously I did a pharmacy degree, and having finished a pharmacy degree and working in hospitals, I quickly realized that my real love was with actually making things better rather than filling people with medicines.
Okay.
I could have gone back to med school, but I couldn't do another 5 years again.
Okay.
So I decided to take pharmacy as far as I could with aesthetics and what I could do to help people with their skin.
Okay.
Along the way, I've retrained. I still do work in a hospital with surgical teams and their clinical pharmacy needs alongside those. But I've retrained with aesthetics, finding very, very natural ways to improve the skin, improve the hair, do the things what people normally turn to with chemicals or toxins or very, very aggressive treatments, but doing it in a very, very gentle way to get the results that they want.
So I think that's the subjects that I wanted to touch on, because I've actually had some treatments done by yourself. Thank you very much.
You're welcome.
Looking forward to seeing the results soon. So the treatments that I'd like to talk about today actually are Carboxy therapy and the PRP. Now, PRP is something you've been doing for hair loss. And let me tell you, everyone, there's tons of you out there with hair loss, a lot of my clients and a lot of friends. So tell us a little bit, please, about Carboxy therapy and PRP.
Okay, starting with PRP. PRP stands for platelet-rich plasma, which is, in a nutshell, the parts of your blood that heal stuff. So when you fall over and you graze your elbow, it's the plasma in your blood that's got all the bits that fixes the bleeding, causes a scab, and makes it all fixed again. When you get a cold, all the good stuff's in your blood is in your plasma that helps cure your cold and that sort of stuff. So
that's called the golden.
Yeah. So
something.
yeah. It is like the little golden elixir from your blood. So that's the really, really good stuff. When you separate it, you get to see it. And what's amazing is that because it heals you, it literally fixes everything. It's almost, the treatment is almost like healing you without falling over and grazing your elbow. So
I mean, the fall's already happened. I suppose that's why you're having a problem with hair loss or
Yeah.
something. So that's sort of the fall-ish.
yeah, so we're fixing it. Hair loss is a it's a gradual process, because the hair kind of grows, stops growing, falls out, then it grows again, and it goes through this cycle of growing, stopping growing, falling out, growing, stopping growing, and falling out. And it's the way that cycle changes that causes hair loss.
Okay.
And with the PRP, what you end up doing is reversing the
cycle.
slowing down. Yeah.
Okay.
So you're making the cycle, the growing part of the cycle, longer and longer.
So just to be clear, you're not putting people's blood back in their body. Right?
No. I'm not taking the blood
So you
out.
separate the blood and
Yeah.
the
Yeah.
plasma.
Yeah. So we just use the plasma part of the blood.
So because people might get confused with the vampire facials and things.
Yeah. So yeah, there's a lot of things about the vampire facial. It's microneedling quite often that just causes blood on the face.
Oh, okay.
You can take the blood and then you put it in. Doesn't you know what?
Yeah. So this is just the plasma bit. It's not the blood back in your body.
Yeah. So you won't end up with blood all over your face.
Yeah.
It's just,
no, I didn't.
So
how long does if people wanted to get the PRP done? How long before people can see the results? How many cycles are we talking about? Is it just the PRP that you're doing, or are you adding other things to it?
Yeah. So we put vitamins and growth factors in with the PRP before we inject it into the scalp. We use tiny little injections.
And they weren't that painful, by the way, because I had it done. And I think after a while, I sort of did get used to it.
Yeah.
There were a few points that were a bit painful. I think that's where you're just a bit more sensitive.
That's right.
But it wasn't anything more than your vaccination or something.
No. And in fact, the device we use to put it back into the scalp, it's very, very controlled and it's very precise. The traditional method of putting the PRP back into the scalp is using a syringe and by hand.
Okay.
That's very painful. That's super, super painful. Well, with this, it's,
it was like a sewing machine, I would say, but very, it wasn't deep.
No.
So it was just quick.
That's right.
Yeah.
And you get a full coverage, whereas by hand, you get just points.
Okay.
So you get a full coverage of the scalp. And you can concentrate on the worst bits. And it's so much better than doing it by hand.
Yeah.
And less painful. Then there's a carboxy therapy element of it, which is we use tiny injections again, just to put some medical carbon dioxide just under the skin.
Okay.
And naturally what your body does is it gets rid of that carbon dioxide by replacing it with very, very healthy oxygen-rich blood, which then feeds your hair follicles again. So it keeps it all nourished and healthy. And as they start to grow. So what happens is after your first treatment, usually after about 3 or 4 weeks, you start seeing less hair on your pillow in the morning, and you see less hair in your shower and on your hairbrush. And then by about 3 months, the hair starts to thicken. So as it's growing, less hair's fallen out, so it's thicker. The hair becomes stronger as well.
Yeah.
And then about 3 months is the time it takes for one cycle, which is a PRP session, 2 carboxy therapy sessions, and a vitamin mesotherapy session.
Okay, and is it affordable for everyone?
It can be, yes.
You do a payment plan, I think.
I do.
Yeah.
I do.
That makes it quite useful. I mean, there's going to be a lot of you who don't know about this treatment. So I think if you do have questions, just let me know, or you can contact Bhav directly. I wanted to ask you as well about carboxy therapy you mentioned for the scalp, but you did a little bit on my hands. And if you can just give us like 2 lines on what the carboxy therapy did for hands or pain or things like that.
So the same way, the carbon dioxide gets replaced by healthy oxygen-rich blood. And what it has is it reduces swelling in the hands, inflammation, and it helps to rebuild damaged parts. And tissue. So it's very, very useful for pain. So we've got a client who had a broken bone in his hand, couldn't move his hand, and we did a few sessions, and then we regained full movement in his hand again.
Wow, it's amazing.
Because the swelling from the pin was just too much.
Okay, and then last but not least, I think a question that a lot of you would like to know is tell us a little bit about any treatments that you think would help with dark circles and under eyes.
Yeah. So firstly, stay very well hydrated. Try and get some good sleep, good quality sleep. After that, carboxy therapy again.
Really?
It seems to be that the wonder thing is so natural.
So you would inject under the eye?
Yeah, under the eye.
Oh, okay.
And then what I do as well is we use tiny micro injections to then make the skin under the eyes very, very healthy. So it takes away that dark pigmented color.
Okay.
So the nice byproduct of that as well is that the under eyes become very rejuvenated as well. So very younger looking.
How many sessions of that would you say?
It's very quick.
Really?
Yeah. The sort of lead time between starting and getting good results can be as little as 4 weeks.
Wow.
So you'd probably have two to three treatments in those 4 weeks, and it's very, very quick.
And last question before we end today's interview, but we will have you on again as our resident doctor, if you like. How much does the under eye procedure cost roughly from to?
Okay, it's about £400.
Okay, which is great for somebody who's had a lifetime of dark circles.
Yeah.
Brilliant. Thank you so much.
You're welcome.
Bhav. It's been really short but sweet, and I think it's been really interesting, little insight into what can be done without adding too much chemicals into your body. So thank you so much for being here.
Thank you for having me.
And I think I will add a link to a raffle prize draw that we're going to be doing as well.
Yep.
Thank you so much.
You're welcome.
Thank you. I wanted to say thank you to our sponsors today. We've got Penny Appeal, and we also have Orix Property Solutions. Now, Orix Property Solutions are a decor and building company, which I know a lot of you need someone reliable and trustworthy to come into your homes and do these things. So the link again will be up, and we will talk about them a bit more next week. But for now, let's do a little bit of a short video on our other sponsor, Penny Appeal. As always, they will be sponsoring. They'll be sponsoring the show, and we'll be working with them to help with, buying a solar panel for poorer countries and food packages for people. Let's go to a short video by Penny Appeal.
In Arua, Uganda, over 1,000 people live in a Luko village. The community rely on water to sustain their livelihood. Due to contaminated water sources, many villagers have suffered from malaria and typhoid. Despite this danger, women and children still walk over a mile every day to collect 40 litres of contaminated water. Without it, their livestock become malnourished and their crops will dry out. This was a community in need, and now, because of your generosity, a solar water well has been built from your donations. It gives the community access to clean water right inside a Luko village. Cases of malaria and typhoid have almost disappeared. And now, a Luko village can flourish.
Hello, everyone. I hope you enjoyed the video. I hope you found it informational. Please do have a look at the link that's going across the screen. And if you can, please donate. It always helps. So for now, I'm going to say thank you so much for joining me today. And I hope you found this episode really interesting. Any questions you have, we'll have Bhav's social media on the link, and you can ask him questions directly, or you can always message me. Thank you so much. See you next week.